of June, we have use of drones in healthcare sector, ICMR guidelines. Now, the Indian Council of Medical Research has released guidelines for use of drones in healthcare sector. The use of drones will improve access to medicines and vaccines, especially in geographical difficult terrain. Now, use of drones in health sector, only 30,000 government-run primary healthcare center caters to nearly 1.4 billion people in India. 5 to 10% of these are not accessible to suppliers and patients because of difficult terrain. This highlights the need to ensure last mile delivery of essential treatment, vaccines, and other medical supplies. Drones have a tremendous potential to deliver vital goods to vulnerable populations, overcoming access barriers and enabling fast delivery of life-saving medicines. Now, the guidelines have been issued in compliance with the new drone rules of 2021, which highlights the way of selecting drones and choosing takeoff and landing sites. According to the guidelines, temperature sensitive medical supplies and vaccine with a storage temperature between 2 degrees Celsius to 8 degrees Celsius are allowed to be transported by drones. Now, tablets, capsules, syrups, surgical blood bags, and diagnostical biological tissues can be transported following the guidelines. Medicine from Sky project is a collaboration of the Telangana government, World Economic Forum, HealthNet Global, and Niti Aayog. Its purpose is to deliver medicines, vaccinations, and units of bloods to remote rural areas by means of drones. Moving on to electric vehicle takeoff and landing, that is eVTOL aircraft, the Union Ministry for Civil Aviation has said that the government is exploring the possibility of inviting manufacturers of eVTOL aircrafts to set up base in India. Now, eVTOL aircraft is one that uses electric power to hover, take off, and land vertically. Most eVTOL use the distributed electric propulsion technology. This technology integrates a complex propulsion system with the airframe. This technology has grown on account of successes in electric propulsion based on progress in motor, battery, fuel cell, and electronic controller technologies. The development is also fueled by the need for new vehicle technologies that ensure urban air mobility. Now, significance of eVTOL. eVTOL is being seen as a runway independent technological solution for the globe's transportation need. It opens up new possibilities that aircrafts with engine cannot carry out in areas such as maneuverability, efficiency, and even from the environment point of view. Now, eVTOLs have been linked to a third wave in an aerial revolution, the first being the advent of commercial flying, and the second, the age of helicopters. Now, challenges with eVTOL are, as the technology so far is a mix of unpiloted and piloted aircrafts, the area in focus includes crash prevention systems, the use of cameras, radar, and global positioning systems, and infrared scanners. Ensuring safety in case of a power plant or rotor failure, aircraft protection from cyber attacks, navigation and flight safety and use of technology when operating in difficult terrains, unsafe operating environment and bad weather. Now bringing eVTOL aircrafts to India. For this, Confederation of Indian Industries, that is CII, Task Force for Urban Air Mobility has suggested policy and regulation changes to better integrate AVAs. It has advised formulating regulations for pilotless vehicles, airworthiness vehicles, implementing efficient energy management systems, onboard sensors, collision detection system, advanced technologies such as artificial intelligence, charging stations, robust air traffic management systems. Moving on to Samudrayan mission, the mission of Earth Science has said that India will achieve the unique distinction of simultaneously launching the first manned human ocean mission Samudrayan as well as the first human space mission Gaganyaan in 2023. Now, the Samudrayan mission is the India's first manned ocean mission. It is part of the Deep Sea Ocean mission. It aims to send men deep into the ocean in submersible vehicles for deep sea exploration and rare mineral mining. As part of the mission in 2023, sea trials of 500-meter rated shallow water version of the unmanned submersible will be done. The trial will be followed by a mission that will send three people to a depth of 6,000 meters in a sea in a manned submarine submersible vehicle called Matsya 6000 for deep water studies. Now, National Institute of Open Technologies, that is NIOT, is implementing agency for the mission. Now, with this unique ocean mission, India will join the elite club of nations such as US, Russia, France, Japan, and China to have niche technology and vehicles to carry out subsea activities. It will be helpful in exploring the minerals and thermal energy in depth of the ocean. It will provide employment to 40 million people in the ocean-based industries by 2030. Now moving on to care for cure for cancer. Now 12 patients in US completely cured of rectal cancers without requiring any surgery or chemotherapy. The trial used a monoclonal antibody called Dostralimp every 3 weeks for 6 months for the treatment. Now about Dostralimab. Dostralimab is a type of monoclonal antibody. It blocks protein called checkpoints, which are made up of immune system cells such as T cells and some cancer cells. Monoclonal antibodies are laboratory produced molecules. They serve as substitute antibodies that can restore, enhance, modify, or mimic the immune system's attack on unwanted cells. Each monoclonal antibody is designed in a way that it binds to only one antigen. These checkpoints help keep immune responses from acting too strong and may prevent T cells from killing cancer cells. When these checkpoints are blocked, T cells are free to kill cancer cells more efficiently. Examples of checkpoint proteins found in T cells or cancer cells include PD1, PDL1, CTLA4, and B71. According to experts, drugs like dostarlimab can be used only in patients with genetic property of mismatch repair, that is MMR deficiency. Now, about mismatch repair deficiency cancer is the most common among colorectal, gastrointestinal, and endometrial cancers. Patients suffering from this condition lack the gene to correct typos in DNA that occur naturally while cells make copies. Availability of the treatment in India. Cost is believed to be a major hurdle. For instance, an immunotherapy treatment can cost around 4 lakh per month, with the patient needing the treatment for 6 months to a year. Hence, treatment experts have said that precision medicine such as immunotherapy drugs for particular types of cancer is still at a nascent stage in India. It would take at least 10 years for it to become a commonplace. Moving on to direct to mobile broadcasting technology, the Department of Telecommunications and Prasar Bharati are exploring the feasibility of direct to mobile broadcasting technology. This will allow to broadcast videos and other forms of multimedia content directly to mobile phones without needing an active internet connection. Now, the technology is based on the convergence of broadband and broadcast, using which mobile phones can receive terrestrial digital TV. It would be similar to how people listen to FM radios on their phones, where a receiver within the phone can tap into the radio frequencies. Using D2M, multimedia content can be beamed to phones directly. Now, applications of D2M technology, it can possibly be used to directly broadcast content related to citizen-centric informations and can be used to counter fake news, issue emergency alerts, and offer assistance in disaster management, among other things. It can be used to broadcast live news, sports, etc. on mobile phones. Now, impact on consumers and businesses. For consumers, they would be able to access multimedia content on video on demand or over the top content platforms without having to exhaust their mobile data and at a nominal rate. The technology will also allow people from rural areas with limited or no internet connection to watch video content. For businesses, it can enable telecom services provider to offload video traffic from their mobile network onto the broadcast network. This will help them to decongest the mobile spectrum. This will also improve the usage of mobile spectrum and free up bandwidth, which will help reduce call drops, increase data speeds, etc. Steps taken by the government to facilitate direct to mobile technology. The Department of Telecommunication has set up a committee to study the feasibility of a spectrum band for offering broadcast services directly to users' smartphone. Now, challenges to the rollout of D2M technology. Bringing key stakeholders like mobile operators on board will be the biggest challenge in launching the D2M technology on a wide scale. A mass rollout of technology will entail regulatory and infrastructural changes. Moving on to International Science Council report. The International Science Council has released a report titled Unprecedented and Unfinished COVID-19 and Implications for National and Global Policy. The report says that COVID-19 pandemic may prevent the world from achieving net zero emissions by 2050. It was formed in now International Science Council was formed in 2018. It is an international non-governmental organization that unites scientific bodies at various levels across social and natural sciences. It is headquartered in Paris, France. Now, the key highlights of the report are three potential scenarios through the year of 2027. The first, which is the most likely scenario, COVID 19 will have worsened inequalities in health, economics, development, science and technology, and society. Now, the second scenario relates to COVID 19 will have become an endemic disease worldwide, and low income states may face risk of health system collapse and growing food insecurity. Mental health concerns will grow even further. The third scenario is the most pessimistic scenario. The world faces high levels of harm to social well being, with long term school closures, unemployment, increased gender based violence, growing nationalism, and polarization will inhibit cooperation on global vaccination and trade, give rise to conflict. Now, recommendations given by the project report are increase adoption of One Health approach to minimize environmental impacts and further pandemic risks, increase investment and knowledge sharing from high income states, address the challenge of disinformation and strengthen diverse scientific advice systems to increase trust in science, thereby protecting societies from acute health risk and breakdown of social cohesion. Moving on, national and global policy considerations should address the widening global inequality not only in vaccine distribution but also related inclusive governance, economic recovery, and digital and educational divide. That will be it.